Hello, everyone, and welcome. Thank you for being here with us, and let's jump right in. It's great to see such a turnout. We're excited to have this conversation and get a pulse on the very latest in employee benefit trends and see how leading organizations are addressing new challenges. It looks like we've got a good-sized group logged on already, so let's go ahead and kick off. A quick housekeeping note. We'll have some time for questions at the end, so please drop any questions you have into the Q&A at the bottom of your Zoom screen, and we'll do our best to answer all of them at the end of this session. The session is being recorded, and you'll receive the recording after the event. We hope that you come away from this conversation prepared and inspired to lead change at your organization. Before we begin, I want to take a moment to introduce myself and the incredible speakers joining us on the call today. I'm Maura Genty, Chief Marketing Officer at Maven Clinic. In my role, I lead growth marketing at Maven, generating demand and helping benefits leaders discover solutions for their employees' health. I literally spend my days hoping to learn from benefits experts like the ones joining me here today and who also registered for this webinar. I'm joined by two incredible guests. First, we have Rahab Hamad, the Director of Benefits at Pinterest. Rahab, would you like to introduce yourself and your role at Pinterest?
Absolutely. Thank you so much, Maura. Hi, everyone. I am Rahab Hamad. I'm the Director of Benefits at Pinterest, where I get to focus on building benefits and programs that really mean something to the people that we support every day. I've been in the benefit space for about 15 years now, so this topic is really close to my heart. And honestly, I'm just really honored to be here alongside two fabulous women for this conversation. So thank you so much for having me.
Thank you for joining us. And we also have with us today Natalie Zatkin, Vice President of Alliant Insurance Services. Natalie, can you introduce yourself as well?
Yeah, thanks, Maura. Hi, I'm Natalie Zatkin. I'm a benefits consultant at Alliant and have the privilege of working with employers to really solve the problems of benefits. It's so complicated, and I'm really excited to be here to talk about this important topic. I've been in the benefit space for nearly 25 years, and it is one of the most exciting spaces to be in, but also one of the more complex. So I'm excited to hear about the benefit trends and participate in this.
Yes. And for those who may be newer to Maven, a quick word about us and why we're leading this conversation. Maven is the world's largest virtual clinic for women and families. We partner with employers and health plans to deliver end-to-end clinical care, education, and navigation across fertility, maternity, parenting and pediatrics, menopause, and more. Today, more than 2,000 employers trust Maven to help improve outcomes, manage cost, and provide equitable access to care across their workforce. Because we sit at the intersection of clinical care, employee experience, and benefits strategy, we have a unique view on how these programs are working in practice and where the gaps remain. Each year, our State of Women's and Family Health Benefits report brings together insights from both HR leaders and employees across multiple countries to better understand how benefits are evolving. This year's findings reflect a moment of real tension. Healthcare costs are continuing to rise. Benefits budgets remain tight. Expectations around personalization, speed, and access are increasing. And at the same time, employees are navigating increased complex health journeys, from high-risk pregnancies to menopause to caregiving, often while managing demanding careers. Employers have responded, and organizations are investing more in women's and family health benefits than ever before. Yet, employee confidence in benefits is declining. This is not a story about employers failing to invest. It's a story about fragmentation. As benefits ecosystems expand, they often become more complex. Employees may have access to multiple point solutions, different platforms, and unclear handoffs. During critical moments, fertility treatment, pregnancy complications, postpartum recovery, that complexity can erode trust and delay care. The result is what we call the perception gap, the gap between what's offered and what the employees actually experience. Closing that gap requires more than adding programs. It requires improving quality, navigation, continuity, and measurable impact. But before we jump into the trends, let me share some background on this report. This is Maven's fifth annual State of Women's and Family Health Benefits report. Each year, we publish this research to better understand how women and family health benefits are evolving and where employer strategy and employer experience may not fully align. For the 2026 edition, we surveyed more than 2,000 HR and benefits leaders and nearly 5,000 employees across the US, UK, Canada, and India. We intentionally gather both perspectives so we can compare what organizations believe they're delivering and how employees actually experience those benefits. Our goal is straightforward. We provide clear, data-backed insights that help benefits leaders improve outcomes, manage rising healthcare costs, and ensure their investments translate into meaningful, measurable support. Today, we'll explore the key findings from the report and the trends shaping women's and families' health benefits in 2026. For each one, we'll look at the data near and hear from Rahab and Natalie on how these dynamics are playing out in the real world and what organizations can do to both improve cost performance and employee experience. We'll start with a quick poll. Now, off to the conversation. We'd love to get this pulse from you about the challenges you're facing and what you're looking to solve for. What is the biggest pressure shaping your women's and families' health benefit this year? Is it rising healthcare costs, employee expectations and experience, vendor consolidation and fragmentation, access to care and provider shortages, addressing coverage for high demand treatments like GLP-1s and HRT, or something else? If there is something, please share it in the chat. Okay, let's go ahead and end the poll. It looks like rising healthcare costs is top of mind for most people, with employee experience and several of these other factors falling fairly closely behind. But rising healthcare cost is definitely top of mind for us. And it's possible that it's a combination, as someone just pointed out in the chat. Now, to go further, let's start with the first trend, the one that sets the tone for everything else we'll be discussing today. Over the past year, employers continue to expand women and families' health benefits across nearly every category, from fertility and adoption support to parenting resources and menopause care. In fact, employers reported an average of 39% increase in women's and family health benefits offering year over year. At the same time, employee sentiment moved in the opposite direction. Across all benefits categories surveyed, the percentage of employees who said that their benefits supported them very well declined by an average of 10%. We saw declines across preconception support, fertility, adoption, LGBTQ plus care, menopause, and more. Now, this isn't a story about employers pulling back. Investment is increasing. Prioritization is increasing. What this data signals is something more structural. As benefits ecosystems expand, they often become more complex. Employees may have access to multiple vendors, separate platforms, and disconnected point solutions. During high-stress life stages, fertility treatment, pregnancy, postpartum recovery, that fragmentation can make support harder to find and harder to navigate. So the challenge isn't whether benefits exists, it's whether they feel cohesive, accessible, and trustworthy when employees need them most. With that context, I'd love to bring in both of our speakers. Rahab, as you've evolved Pinterest's benefit strategy, how do you think about expanding support without creating additional fragmentation or confusion for employees? How does Maven fit into this benefits design strategy?
Yeah, thank you so much, Maura. I think we're at a real turning point right now within just the benefits world, where leaders are really just actively scaling back the number of point solutions and focusing on meaningful outcomes and data. So not just adding more programs. That shift is exactly what shaped how we evolved our strategy at Pinterest. So for a while, we were doing what a lot of organizations do, layering on solutions to meet each new need as it emerged. So fertility support here, maternity support there, something for mental health, something for menopause. And on paper, it looked really comprehensive, but what we were actually creating was confusion. So employees didn't know where to go. They couldn't navigate between programs. And that experience just felt fragmented at exactly the moments when they really needed it to feel seamless. And when I think about the most like what's most affected by that fragmentation, I would say it's women. Women are the primary healthcare decision makers for their entire families. They're engaging with the healthcare system across every life stage, fertility, pregnancy, postpartum, and then years later navigating perimenopause and menopause, which I would say is still so under discussed and under supported in the workplace. When the benefits ecosystem is fragmented, women bear the heaviest cost of that confusion because they're in it the most. So when we evolved Pinterest's strategy, the question I kept coming back to was, can an employee actually find and use what we've built for them? And if the answer is no, it doesn't matter really like how generous that coverage is. To your question about how Maven fit into this benefits design strategy, I think what made it really clear for us and what Maven made is that like made it such a clear fit for us, is that it's one connected platform and employees really don't have to start over and start with a number of different new tools every time they need a change. So it's just one relationship built over time. And from a benefits design perspective, it really just lets us consolidate without sacrificing that depth of care.
Absolutely. And that's where a platform can really make a difference, not just in coordinating the care of the loss or across the life stages, but making sure you get ahead of risk and that you make all of those costs predictable. Natalie, from a consultant standpoint, are you seeing employers struggle with vendor sprawl and benefit complexity? And what differentiates the organizations that are successfully closing this confidence gap?
Yeah, it's really it is a trend that we're seeing, and I want to echo what Rahab said. It's taking those very much those important moments that matter and having a solution for all of those. It's not for lack of investment. The employers they have a solution for cancer, maybe for musculoskeletal, family building, but really the employers that are successfully utilizing all those are doing sort of three things, and they're simplifying the entry point so employees know where to start. And that includes consolidating solutions wherever possible. So there's really a spectrum of solutions, maybe under one hub. So they know that if it's a family building question, whether it's Maven or one of your competitors, that they know where to start. They're also making it easier to understand and navigate those benefits. So that's whether that's through communications, direct home mailers, just getting the whole family involved. And then they're measuring success. So are those programs working? Are we seeing the surveys from employees and dependents respond? Are they using the benefits? So really at Alliant, we're describing that not so much as a individual experience, but delivering a cohesive experience so that those investments really pay off and you really see the ROI.
Thank you. And speaking on measurability, for both of you, what signals should organizations look at internally to understand whether employees feel supported beyond simple utilization metrics?
I'm happy to go first. I would say that utilization tells you if people can find the benefit. It doesn't actually tell you if it's working. And I think that's where a lot of benefit strategies can stall is you hit a utilization target and then you call it a win. So the signals that I actually look for kind of break down into three areas. So there's engagement at critical moments. So are people finding the support during a time when they really need it the most? And are those resources available to them right away? Then there's downstream workforce outcomes. So thinking about what relates to the leave of absence data, like return to work rates, retention at 12 months post leave, and then absenteeism. And then finally cost. So this is where you can look at claims duration, STD spend, and LTD conversion rates, and just making sure that you and finance are aligned.
Yeah, and I would just add to that we're really being diligent with our clients to measure those annually and semi-annually or even monthly as needed. So it's not something that you look at once or at implementation or shortly after. You're looking to ensure that employees and family members can access those solutions on an ongoing basis and really looking for opportunities to boost or supplement.
Thank you. And speaking of care when it's needed the most, our second trend moves from perception to cost, specifically that growing financial impact on high-risk pregnancies. 57% of benefits leaders report that high-risk pregnancies have increased healthcare costs for their organization. At the same time, maternity costs overall have risen sharply over the past decade. Employers are responding. Many are expanding maternity support, increasing care coordination, encouraging dual use, and offering virtual maternity services. But here's where the data gets more concerning. Employee understanding of high-risk pregnancy remains limited. Only 3.5% of employees correctly identified all the conditions that can make a pregnancy high risk. 82% don't believe IVF increases pregnancy risk, and 91% don't believe surrogacy does. At the impact as that impact extends beyond pregnancy itself, only 32% of HR leaders say all or almost all employees return to work after parental leave. So while organizations are investing more in maternity support, risk is often identified too late. Education may not reach employees early enough, and care coordination may not begin soon enough to prevent complications. The opportunity here isn't necessarily to add more maternity benefits. It's to intervene earlier, simplify navigation, and connect support from preconception through postpartum and return to work. With that framing, I'd love to bring this to both of you. Natalie, from your vantage point, advising employers, where are you seeing the biggest gaps when it comes to managing high-risk pregnancy costs? Is it education, early intervention, care coordination, or something else entirely?
Well, it's all of the above. And maternity is such a, especially high risk pregnancies are consistently one of the top drivers of healthcare spend for employers. And as your report testifies to that, we're also seeing that in stop loss claims. Neonatal and NICU related claims remain amongst the highest from a severity and cost perspective, ranging, averaging 500,000 to some outliers at 10 million. So the issue is not that employers aren't investing in education or sort of care coordination. Most are. The gap is whether employees are receiving that support, like as you said, at the moments that matter and when they can actually influence outcomes. So the employers that are sort of getting ahead of that are using population health and claims data to identify higher risk population groups. So that could be a combination of really looking at chronic conditions, maternal age, and fertility utilization, and then targeting that support sooner. So really, it's this ongoing challenge of not being reactive but being proactive with the data, so that you can actually influence the outcomes.
Great. And Rahab, how do you think about supporting employees early in that journey proactively before complications even arise? And how does that tie into both cost management and return to work success?
I would say that what the data really tells us is that the cost problem is really actually also a timing problem. So most of the risk and the cost is created well before anyone is on leave. It's created when someone is navigating a high risk pregnancy and doesn't even know it. Because they don't know what high risk actually means sometimes. So by the time support kicks in, you're already behind. So when you try to catch the risk earlier at preconception, not at complications, you're really shortening those claims and stopping short-term situations from becoming long-term ones. That's where the real cost exposure lives, and that's where early intervention actually really moves the needle. I would say that it's important to also just stay consistent all the way through the family planning journey, and return to work planning. And that's what really makes the investment case sustainable, even when you're talking to finance.
Absolutely. And with that, we'll move on to the next major trend. Our third trend reflects a behavioral shift that's happening quickly and largely outside the traditional benefits ecosystem. And of course, we're talking about AI. Employees are turning increasingly to AI tools for health information before they turn to employee-sponsored resources. In fact, 81% of employees report using AI to find health information, and 59% say they use it daily or weekly. More notably, 33% have taken action based on AI-generated information, whether that means starting or stopping a medication, scheduling an appointment, or changing their diet. And they're doing this instead of using more trustworthy resources. Only 6% of employees say they turn to employer resources when they first have a health question. From the HR side, there's clear tension. Nearly 9 in 10 benefits leaders express concern that employees may make decisions based on inaccurate information from AI tools. Many also cite data privacy and compliance risks. The conversation isn't whether AI will be used, it already is. The real question is whether employers provide a trusted, clinically grounded entry point so that employees act on accurate guidance rather than fragmented or even potentially unsafe information. The use of consumer AI platforms creates real risk here: unmanaged care, missed early intervention, and data privacy concerns. But there's also opportunity. Employees want fast, accessible answers. Organizations that combine innovation with clinical oversight can meet that demand while protecting costs and outcomes. With that in mind, would love to hear your point of view. Rahab, how are you thinking about AI in the context of employee health decisions, and what responsibility do you believe employers have in guiding employees towards more trusted, clinically sound information?
I think as AI is already part of how people live, employees are using it to plan their weeks, answer work questions, and just understand their health. So it's not a separate behavior that only happens in the health context. It's just how people really get information now. The real question isn't whether employees will use AI for health decisions, because to your point, they absolutely will, and they already are. The question is what happens next, and not in the AI itself, but in the gap between the AI answer and a trusted next step. So I would say that the responsibility employers have is to try and close that gap, not by telling employees to stop using AI, but by making sure that there is a clinically grounded resource that's sitting right alongside it. So when someone gets an answer from something like ChatGPT about a symptom or a medication, there should be somewhere obvious and easy for them to go to validate that with a real practitioner who knows their full picture. So because without that, employees are really just making high stakes health decisions in a vacuum. The stakes of acting on inaccurate information will just compound and are compounded at every level.
Absolutely. That really makes sense. Natalie, what are you hearing from clients around AI governance, both in terms of privacy and in terms of compliance? And I'm sure there's other factors going into it. What are your biggest recommendations for employers who are evaluating AI-supported health benefits right now?
Yeah, it's really a mix of urgency and caution. So it's like, let's go, but we need to look, right? And really the biggest concern is what Rahab mentioned, which is just around accuracy. And I think Mara, you mentioned it too. So you're wanting to put more solutions out there and get employees and their family members the answers they want because they want the answers quickly. They're getting them already. They're paying for, the services. They're getting them outside of the benefits, ecosystem that you're in. So we're trying to be very thoughtful in looking at these solutions because they're really cropping up literally every day. I know I'm getting pinged by new AI solutions. And what we're really trying to do is to take a thoughtful step back, not too far back, but to give ourselves a pause and look at these solutions. So what we're looking at is how are the recommendations and responses being generated and clinically validated? We're ensuring that there's appropriate data privacy, compliance, and oversight included in each solution. What's the base for the solution? Are we teaching the solution? Has it already been, how long has the solution been available and been trained? We're understanding how the solution, if it's a new one, integrates with the existing partners that the employer works with and workflows, because a lot of your existing partners and vendors have rolled out or have an AI roadmap that is literally changing month by month. So there may not be a need for a new solution. You really need to also look at what you're currently doing and what you're maybe not even taking advantage of. And then lastly, we really want to make sure that whatever this new solution is, really does what it says, right? Is it actually going to improve engagement, decision making, and outcome? So it's a little bit of an arms race right now with which solution you go with because there's such a new crop and it's very exciting, but we need to really be thoughtful about how we're evaluating them.
That's really interesting. And then I just want to add, how do you both stay ahead of the rapidness of that change? Like how do you move with all of these exciting new times, but make sure the information is correct and also do that appropriate right amount of vetting for your organization?
I mean, it is not unlike the 5 or 10 years ago where there was a new point solution for every problem. So we're all sort of learning it together. And I think, you know, we're sharing information. I mean, literally, Rahab and I are like, well, how should we be thinking about AI? And we're
Mhm.
sharing that data with others. So a lot of it right now is almost like group think and
Mhm.
sharing. So I think the most that we can do right now as a community is share best practices and share your learning. So if you have put in a solution that's been really successful, like share that and what have been the concerns. So we're doing the best that we can to share that as quickly as possible, so that we can get best practices out there.
Yeah, I agree 100% to what Natalie is saying and just sharing that with your community. I'm in the benefits community and we'll talk to different benefit colleagues and understanding how they're thinking about it for their workforce. And it really is just a group think as it's continuing to evolve.
Well, it's hard to step away from AI as a fascinating topic, but I do want to move on to a little bit more of another trend, which is around consumer health. Our fourth trend highlights how consumer health trends are shaping employee expectations, often faster than traditional benefit cycles can even respond. Employees are seeing constant advertising and online messaging around GLP-1 medications and hormone replacement therapy. I know I've seen this a lot, and consumers are acting on it. 61% of employees report taking action after seeing a GLP-1 ad, and 70% report taking action after seeing a hormone replacement therapy ad. That action may include research online, speaking with a doctor, or in some cases, purchasing medication directly. At the same time, expectations around employer coverage are rising. 53% of employees believe employers should cover HRT, and 47% believe employers should cover GLP-1s as well. This trend creates a complicated balancing act. On one hand, employees want access and autonomy. On the other, employers must consider clinical appropriateness, long-term safety, and sustainable cost management. And while more than half of employers have already added or expanded coverage or education related to these treatments, coverage decisions alone don't solve the challenge. Without education, clinical guidance, and navigation, as we've mentioned before, employees may pursue treatments that aren't appropriate for their individual health, or they may lack support to manage side effects and long-term outcomes. The opportunity that we see here is to pair visibility with guidance, to help ensure employers have access to evidence-based information and expert support before they make high-impact health decisions. Natalie, how are employers balancing rising demand for GLP-1s and HRT with long-term cost management? What considerations do you hear about from clients who are making these coverage decisions?
I'll start with GLP-1s first because I don't think a meeting goes by where that does not come up as a conversation. We're hearing strong demand, obviously, from employees. And we do see that about half of employers do cover GLP-1 for weight management. But we're seeing escalating costs. So costs that are in some cases doubling or tripling sort of year over year. So employers are really looking at this and thinking about the financial sustainability. There's obviously been a growing number of reports that we're seeing strong health outcomes from that, but employers still need to manage their business and manage their budget. And it can be hard to do that when your GLP-1 costs are tripling. So what they're doing is really a couple things. On the GLP-1 front, we're looking at appropriate clinical guidelines. So looking at coverage that is or coverage requirements that go beyond prior authorization. So guardrails that maybe require members to engage with a clinical program to ensure that they're on track and they're meeting their goals. They're looking at their population profile and chronic conditions to see if GLP-1s would support that. And in many cases, there is a strong tie. And then they're also evaluating that potential return on investment to help tell that story. But it is a challenge, and it's an ongoing challenge. And we need to come up with a continuous way to allow folks that need to stay on the GLP-1 because these could be lifelong drugs for some people that an
Mhm.
employer to employer switch would not change that. Um, and then from the HRT front, at least most of the groups that we work with do have that covered through the medical plan, but I think the challenge is the awareness of that and getting folks and getting women to that access point. So it's not that it may not be covered, at least, it's just how do I get to the HRT? And this is really where virtual care and more integrated models can step in and play that role to close that gap so that there's more access points to the HRT therapies.
Makes sense. And then, Rahab, how do you manage employee expectations that are shaped by all of this consumer advertising? And what role does education or clinical guidance play in helping employees make those informed decisions?
I think the cost pressure is real, and I'm seeing more companies that are like more partners and employers adding those guardrails around GLP-1s, specifically because the financial impact is significant. So the balance that I'm trying to strike is how do we honor employee interest in these treatments while also making sure coverage is clinically appropriate and financially stable? I would say that the clinical guidance really helps to bridge that gap. A good care navigator isn't just coordinating appointments, they're really having honest conversations that advertising doesn't do. And so when the conversation really happens early and just feels really supportive rather than deflating, it starts to build that trust.
Yeah. It's
Absolutely.
it's it's such an I mean, it's such a sort of inflection point right now with coverage where, and I think I saw in some of the chat that, we're having, whole systems drop coverage or because it literally could bankrupt
Yeah.
whether it's a retirement system or what have you. So we have to be very thoughtful. And we are seeing consumer trends. Really, some employers are taking those as an off ramp, which isn't always the greatest strategy, but sort of like, hey, I can no longer support this from a financial perspective. And it's becoming more affordable from a consumer perspective. So there is this sort of tension that's happening now. And we're definitely talking to employers about that.
Makes sense. And in a similar vein, with all of this like new direct to consumer
Mhm.
conversation, are there other consumer health trends that you see impacting benefits design today?
I mean, there's so many trends out there that it's hard for an employer to solve for all of, whether it's nutrition or health coaching. I mean, we're definitely seeing trends where those could be great places for a consumer to sort of work directly with a solution, and maybe that could supplement, what the employer offers.
That that sounds like the right plan.
Mm.
The next topic that we'll go through and the fifth trend, our final trend actually brings us back to a fundamental issue that I'm sure many of us have spent a lot of time discussing, which is access. Even when benefits are in place, employees can't benefit from them if they can't access care in a timely way. This year's data shows that 27% of women delayed or skipped routine health care in the past year, which is a number I know that surprised many of us internally at Maven, even if, like myself, I'm a victim of it too. And the reasons are largely logistical. 53% said appointment times didn't work, 39% cited long wait times, and 24% reported transportation challenges. What's more, these access gaps are not evenly distributed. 31% of on-site employees delayed care, compared to about 20% of remote or hybrid workers. And 75% of US HR leaders said they're concerned about reduced access to maternity care due to hospital or provider closures. These delays also have downstream effects. When employees postpone routine or preventative care, health issues escalate, costs rise, recovery takes longer, return to work timelines shift. This trend reinforces an important point. Coverage alone does not equal access. Employers must remove fiction, whether that's scheduling barriers, provider shortages, benefits fragmentation, or lack of clear navigation if they want benefits to translate into real outcomes. Virtual care, coordinated navigation, and flexible platform models are becoming less of a convenience and more of a necessity. With that context, I'd love to hear how this is showing up in your work. Natalie, where are you seeing virtual or integrated care models make the biggest impact?
Yeah, I mean, as you stated, access remains a fundamental challenge, and that could be access because there literally aren't providers in a certain area, or that it's a convenience, right? I can't get that appointment. So, um, where we're seeing virtual care and even integrated care really support that is really improving that speed to access. So getting in with a clinician within a few days instead of a few weeks or months. We saw that as a really key point during the pandemic with mental health, right? Getting those providers in, and we've continued to see success around that. Really helping with getting earlier guidance and support. So whether that's getting answers to early questions to pregnancy, early answers to pregnancy questions, or understanding symptoms before they escalate, so that not waiting for that sort of next in-office appointment, and also getting that care throughout your journey. So having that virtual care touch point in between maybe your points with your primary care or maybe OBGYN. So at the same time of sort of this expanse in virtual care, where we're seeing, really plug a lot of those holes, there's really been a focus on integrated care models. And from an Alliant perspective, fragmentation remains one of the biggest structural challenges that we see. Employees, as we mentioned earlier, navigating multiple vendors and disconnected programs. So these integrated models where you can bring clinical care navigation and support across your full journey is really where we're seeing those models be very successful, because we're hoping that with really more engagement, like true engagement, you're going to have better outcomes. And that really sort of ties back to some of those high risk pregnancy conversations that we had and other, sort of, it's not only about cost, it's really moments that matter, and we can influence it.
Absolutely. And the other part of it is that there's sort of this outdated view that virtual care is just technology for technology's sake. I think I remember that from like over 10
Yeah.
years ago. It was just starting out. And it's a feeling that, oh, this might be disconnected from actual care and outcomes. And we know that that continuity of care can really happen from a virtual platform. And it's a way to improve that early access. So not only you're helping people get in something that is how they navigate the world, but we're helping people navigate from pregnancy to postpartum to parenting. So that continuity of care is also something that is can be more effective in the virtual platform. And it's also that combination of in-person and the virtual and making sure it's all connected so that it's not like a new person knocking on the door every time you have a visit.
Right. It's also better when you have the same person, right? And
Yeah.
you can usually find, there's some great programs out there where you really have a dedicated support. And again, whether that's mental health or pregnancy support, postpartum, or, sleep training, whatever it is, that you can continue to go back to that same coach, or provider that, so you're not sort of rehashing your story over and over again.
Absolutely, especially when you have all of these specializations available at your
Mhm.
fingertips. Rahab, what access challenges have you seen in your workforce, and how did that play a role in your decision to adopt Maven?
It's a really good question. I would say that access can definitely be a challenge for us, but what makes it complicated is not a coverage gap. Our employees have coverage. The barriers were really just everything around it. So geography, scheduling, and honestly, the constant instability of network negotiations. Provider networks now change regularly, and every time they do, employees who thought they had access suddenly don't. And you're seeing that in the last 2 to 3 years there's just been a huge uptick in provider network instability. And I just saw this in New York with Mount Sinai and Blue Shield. So this instability, I would say it actually brings virtual care to the forefront again, which is really positive. And a really good example is like the virtual care through Maven. I think virtual care through Maven is a really good example of creating more access points and a stable and consistent access, especially with what's happening with the different network changes. And to Natalie's point of like having that same person and having that through Maven and going through that with those access points is was really valuable.
It just sounds like it's quite a tempest right now between the AI changes, consumer trends, and network changes, all while costs are rising. So it's phenomenal that people are able to really keep up and try to do the best for the team that they work with and the legacy that they leave for the company they're supporting. Great to hear about all of this. And now I want to dig in a little bit into Pinterest more specifically. Rahab, you just explained a little bit about how you decided and your team decided to build a benefit strategy that included comprehensive women's and family health benefits. I'd like to hear more about your experience since implementing Maven. How has this approach resulted in a meaningful impact for Pinterest and for your employees?
I will say I've been a Maven fan for years now, and so I'm so excited that at Pinterest we did recently move to Maven this year. So we're early in the journey, but we've already seen 455 program activations, and those are unique members since launching this year. And 26% are male users and 74% are female. So the feedback that we've received and are already hearing from employees has been really meaningful. So people feel like they finally have somewhere to go. And it's one place that understands where they are in their journey and it meets them there. So I'm really excited.
Great. And that's one thing that I also love because Maven does cover the partner for free, which is something we probably don't mention enough. But there's a huge role of men and partners in this whole journey in the family building arc through parenting and midlife care. With that, we want to talk a little bit about the Maven impact. We see that when employers provide comprehensive fertility and maternity benefits, the results are clear. There are better outcomes for families and meaningful savings for employers. Overall, our members see up to 27% lower NICU admissions. 30% of family members achieve pregnancy without treatment, and 70% of maternity members are more productive. Overall, 96% of family building members are more loyal to their employer. And these types of outcomes make it really clear how important it is not only to deliver women's and family health benefits, but to make sure that those benefits are comprehensive, that they are easily accessed, and that they're supportive across this continuity of care and available in any moment. As we head towards wrapping up, I want to just say thank you so much to Rahab and to Natalie. We could keep talking all day. We were even talking about prep routines before this. But we're reaching out at the end of our time together, and I wanted to leave some space for some audience questions. So we'll look at some of the questions that have come through in the chat. And while we're looking through those questions, we're going to launch a quick poll on screen to ask for your feedback about the event today. We're always learning. We want to hear from you. So please take a moment to share your thoughts. Oh, and as a reminder, you can continue to access the Q&A by clicking at the bottom of your Zoom screen. We've already received a few questions.
I think, Rahab, your comment about Anthem and Mount Sinai has triggered a few questions and comments. We're definitely seeing, yes, some network negotiations really heat up in the last couple, 3 years, and some of them are not resolving.
Yeah, that's what we really recently ran into, which is surprising. I know that we talked about that too, is that we've never seen it where network negotiations actually don't end well. And so
Right,
that's what
right.
we're starting to see, which was the first time I saw that with Mount Sinai.
Yeah. Do you find that the cost of high-risk pregnancies gets into stop loss insurance? If so, do you see that as a fact, do you see it as a factor that's directly responsible for increasing healthcare premiums?
So yes, on both. So high risk pregnancies and stop loss insurance are very sort of much after a certain, point, a deductible, your stop loss insurer is sort of responsible for the claims. And as they're seeing those claims escalate, it directly impacts the stop loss renewal and the stop loss marketplace. And we're definitely seeing higher rates because of the complexity and severity of NICU claims. Like I said, I saw in a Sun Life report, this was maybe in the last year or so, an $11.5 million claim. So that's obviously a huge outlier, but when you're seeing those be on average 500,000, it definitely impacts, if you're insured, fully insured, your renewal for the next year. And it's not something like we talked about, we try our best to sort of alleviate or sort of minimize those, but sometimes there's just nothing you can do, right? It's just an unfortunate circumstance, and it does directly impact healthcare costs.
Yep. Does proactive education look the same for all segments of the population when you're identifying high-risk pregnancies?
I
You
don't know if it
know,
looks the same
yeah, go
for
ahead, Rahab.
everyone.
No, go
I would
ahead.
say you're catching everyone at different life stages, so I think it would need to be tailored. Natalie, what were you going to add? I wouldn't say that it would be the same across the
Yeah,
board.
it's really going, you have to look at your population, and even within your population, you have to look at the populations you have. We have multiple generations working at the same organization, and they respond to communication strategies very differently. And you also need to be very thoughtful about if you're sending information about maternity care that you're being generic at it. You're not targeting. So you're trying to get the information out. So that can be digital, that can be home, that could be Slack channels, whatever you use to make sure that people know. That could be ERGs, right? You need to sort of have this multifaceted approach to not just sort of get the message out, but continue to get the message out.
Is there anything else that you do that helps get to that early visibility around a high-risk pregnancy? I think we talked a little bit earlier about how many folks don't even know what a high-risk pregnancy is. I personally was shocked when I read the report, and I think only 18% of people knew that an IVF baby was inherently a high-risk pregnancy. So how do you get that information out? How do you get to the early visibility around those populations?
This is where I would say a solution like Maven is always super helpful. When you're in the family planning journey and accessing it early on, having employees know right away that, okay, this is really exciting in my family planning journey, and I know that I have a solution like Maven, they can already start to get connected to clinical guidance and support throughout and knowing what a high risk pregnancy is. Because to your point, IVF could be considered a high risk pregnancy. And a lot of people don't know that. And so talking to someone at Maven and having the Maven support throughout that entire journey, I think is a perfect step.
Yeah, and I would just double down on that, and I think having those experts available in a network quickly, and not having those barriers to access to ask any of those questions. And those can even be questions that you use then for your OB. It's like you're going in there and sort of doing your homework. So making sure that any solution that you're providing is really marketed as available to all, right? Whether you're preconception, considering, etc., that it's available to everyone.
And this goes back to the conversation that we were having around having too many point solutions and just
Yeah.
thinking about how you're approaching it with employees is trying to find one solution versus several, because historically we've launched so many different point solutions and it really does become confusing for employees. So just bringing it all together, I think, is really valuable.
Absolutely. And that's a really good point. You mentioned that like going from family building IVF into maternity care, that's a place where it naturally makes sense to consolidate vendors. But as these benefits ecosystems are more complex, as AI goes back and forth with so many of them, as the consumer demands increase, how do you decide when it's time to consolidate vendors versus layer on another solution?
We actually introduced a formal exercise here at Pinterest where we now complete annually what we've built, and alongside Alliant too, which was really cool, is a vendor scorecard. And so this assigns weights when we're looking at all of the different point solutions across different areas. And so I would say it's really important to do this annually for all companies if you have so many different point solutions. So our vendor scorecard, it assigns the weight across four areas. So we're looking at employee feedback, clinical outcomes, strategic alignment with Pinterest goals, and then cost performance. So having this in place really helps us maintain quality and control costs across a number of ecosystems. And the scorecard serves two purposes. So first, it keeps current vendors accountable. So are they consistently delivering the value? And are they still aligned with where our workforce needs are going? And then are they aligned with our company values? And then second, it informs future planning. So when we're evaluating a new vendor or running an RFP, we're benchmarking against the same criteria. So we're making decisions based on the data and not relationships. And then we also conduct an RFP at least every 3 years to make sure that we have the best partner in place and that we're staying competitive. What I really love about this process is that it also creates just an honest conversation with our vendors. They know what we're measuring, they know what we value, and it really just pushes them to keep improving. And that's also good for employees and good for Pinterest.
I absolutely love a good framework. So I love hearing that and what great work that you built together. This idea of a data-based rubric brings me to the notion of, this is a scorecard, it's got objective criteria. And then when you're looking at evaluating whether a benefit is truly working, what metrics carry the most weight internally? Is it utilization? Is it employee feedback, clinical outcomes? Employee retention, or are there other factors that you're looking at when you really try to make this process as objective as possible?
I would say that we weigh it across all four when we're evaluating the vendors. So we do look at all of them, and they're all weighted differently, and it depends on the category under whether it's emotional well-being, family planning, and then we revisit every year collectively. So it's weighted across. So employee feedback, clinical outcomes, strategic alignment with our goals, and then the cost performance.
Got it. And then Natalie, I love that you are a partner in this, and you have such a unique point of view by looking across this larger client base. What would you say are what are the things that forward-thinking employers are doing right now when it comes to women's and families' health, and other things that you see people doing that aren't really caught up yet?
Yeah, I mean, I have the privilege of working with many forward looking and progressive employers. And so it's when I do benchmarking that I realize, oh, this isn't sort of the norm. So some of the things that are happening that we've seen over the last, even 10 plus years is that when we think about family building, really broadening the eligibility of fertility programs has been one, covering elective fertility preservation, like egg and sperm freezing, and creating more equitable support for adoption and surrogacy. We're also seeing that to the extent possible translate globally if there's a global population. We're also seeing more expansion into underserved areas like menopause support. That includes flexibility around leave, manager training, so really supporting those women going through menopause. We're also seeing, a continued focus on caregiving. I think somebody in the chat put like that can sort of take a lot, that really can be of huge impact to productivity. So, and it's not just for children, it's for aging parents or others. So caregiving has been a really big focal point. And then a really foundational mental health support across all of that. So whether it's a family building journey or a caregiving journey, ensuring that we have appropriate mental health support for that individual. And that sort of creates a really nice wraparound because all of these, you know, are such important moments and transition moments for those folks. We want to make sure they have the appropriate support.
Yes, that all of this brings back to like these ideas of communities and the getting that right information out there. I do feel like one of the most important phrases in the English language is "you're not alone." So it feels like that keeps on coming back as a part of it. The other thing that keeps coming up with this is of course costs. That was the top of the poll is these predictable costs, which means that your finance team is now your best friend. So I'm curious, how are benefits leaders successfully aligning with finance teams to make the case for investment in areas like maternity, menopause, and fertility?
Uh, we are bringing them in very early.
Hmm.
It is not here are our initiatives and let's look at this and then bring in finance. It's here's our budget finance, these are the considerations, and they're part of the early stages and understanding the investment and the value, the utilization. We're showing them the scorecard. So there are no surprises. And there's more of a conversation to understand finances goals because cost management is literally the number one trend, right? I know we talked about a lot of trends, but all of those are in the sort of context of healthcare costs and trends are at their highest in the last 10 years. And so we have to be very, very strategic in the investments we're making in finance as part of all of those conversations.
I couldn't agree more. Natalie, and you see that how we do this all the time when it comes to
Yes.
finance. It is so important to have such a close relationship with your finance team and bringing them in early on. A lot of times, what we do is historically, sometimes you would meet with them once a year during renewal planning, and that would be it. But what we do is meet with them monthly or even bi-weekly if we need to. And it's just providing them that education on claims in partnership with your broker. And so we'll meet with Alliant and our finance team regularly to be like, does this make sense? Let's track our PMPM. Let's look at claims. Let's look at RX together and just having that conversation with them. And then also just asking them and understanding what their strategy is too, so that you make sure that we're aligning and that we're providing them the information that we need. So with our vendor scorecard, we will meet with them to go through that, and then we'll go through our budget, and then we'll actually go through claims actuals and just meeting with them. So having that relationship, I think, is your should be your number one priority.
Agree. And I would love to ask both of you as our last question, if you had one recommendation to make for an immediate next step for benefits leaders after they see this session, what would it be?
I'd say start looking at your data.
Yep, I agree. Build a relationship with finance and look at your data. Jump into the data and look into it.
Get in there and
Yep.
figure out, where do you have gaps? Where are you not achieving the outcomes that you want? And if you don't have the data, push for it.
Absolutely makes sense. And that's what makes me proud to work at Maven, knowing that we have some of the highest clinical ROI across the largest population. And you only get there by having the data and knowing who you're serving. So thank you both so much for joining me today. For everyone else here, if you have any additional questions or want to connect with a member of the team, please send us a message on our contact page. That's mavenclinic.com/contact. And if you're interested in downloading the report, you can scan the QR code on your screen right now to get to it. Thank you so much for all of you for participating today, and thank you for the amazing questions. We're so happy you were able to join us. I also want to say a huge thank you again to Rahab and Natalie for joining us and sharing all of your incredible insights. I know I learned so much today, and thank you again. Have a great rest of the day.
Thank you.
Thank you.